seniors, juniors, and my dear colleagues. Today I'm Dr. Hemashri, Junior Resident from AIMS, New Delhi, from the Department of Surgical Disciplines. Today I'm here to present a topic on preoperative orders, how to write a preoperative orders. These are the written instructions that are to be followed by the patient and nursing staff on the day prior to the surgery. So this is basically a collaboration between an anesthetist, a surgeon, the nursing staff, and the patient. So the main contents which we need to write in a preoperative orders, the date on which you are writing the preoperative orders, and the patient details, the basic demographic details of the patient, the name, age, sex, and any unique identity code that are assigned to the patient. And it should include the diagnosis of the patient, the surgery that the patient is undergoing, and the date of the surgery, and the main instructions that you're giving the patient or the nursing staff, and the signature of the resident who is writing, and the clear name and designation of the resident, so that the nursing staff can get back to you if they have any queries regarding the instructions that you have given. I have basically divided them into elective, emergency, and daycare surgeries, and the instructions that you need to give in each of them. For the elective surgery, first you need to ensure that you have taken the proper consent from the patient, which includes their signature and the signature of the witness and your signature. And you have to give instructions regarding the fasting, the hours of fasting, and also plan beforehand the prophylactic antibiotic that you want to give in that surgery. And also ensure that the skin testing has been done before giving the antibiotic. If in the major colorectal surgeries or any intra-abdominal surgeries, we have to ensure that the bowel is properly prepared, and also the parts of the surgery that are prepared. And also we have to follow the pre-anesthetic orders. So coming to the consent, what all need to be mentioned in a consent are the patient demographic details, the diagnosis, the available treatment option, risks and benefits of the surgery, and also your signature and also the patient's signature. Next, coming to the fasting, first, as per the ASA guidelines, they mention that for solids you need at least 6 hours of fasting, and for clear liquids 2 hours of fasting is needed. In case of infants and children, if they are being breastfed, at least 4 hours of fasting is needed, and if they are on formula feeds, at least 6 hours of fasting is needed. Coming to antibiotic prophylaxis. Why are we giving an antibiotic prophylaxis? For clean surgeries, it is not usually needed, but in case of clean contaminated, and in dirty surgeries, it is needed to prevent wound infection and surgical site infection. So when should it be administered? Ideally, it has to be administered 60 minutes prior to the surgery, so that there is the maximum onset of action would be at the time of incision. And for vancomycin and fluoroquinolones, you need to administer it 120 minutes prior. The antibiotic that you're giving should be a narrow spectrum of coverage, which the pathogens that you encounter during surgery, that has to be covered. And they should not be the therapeutic agent for that pathogen. And also make sure that skin testing is done before giving the antibiotic in case of penicillins and cephalosporins to prevent any allergic reactions. So this is how we classify the surgical wounds: clean, contaminated, and dirty wounds. So based on that, clean surgeries, like for example hernia and breast surgeries, no prophylaxis is needed. And if you are inserting a prosthetic or an implant, it is ideal, but better to give a single dose before surgery. In the other surgeries, in contaminated surgeries and dirty surgeries, we prefer a first generation or a second generation cephalosporin. If the patient is allergic, we can use an alternative like a clindamycin, vancomycin, or a metronidazole and aminoglycoside based on the pathogen that you encounter during the surgery. This is an example of preoperative orders that we wrote for a Whipple's procedure. And here we have taken a third generation cephalosporin, an aminoglycoside, and metronidazole. This also includes the bowel preparation and also antibiotic prophylaxis for the gut, which I'll be dealing next. So coming to the bowel preparation, which we need to give in major intra-abdominal surgeries and colorectal surgeries, a mechanical bowel cleansing and an antibiotic prophylaxis both are to be used. For mechanical bowel cleansing, we use a polyethylene glycol solution or a proctoclysis enema. And in antibiotic prophylaxis, we can use either oral or IV, or you can use both. So for oral, we use neomycin, metronidazole, and erythromycin. And for intravenous, we can use metronidazole and first or second generation cephalosporins. So this, first we have used the mechanical bowel preparation using Exelite, which is a stool softener and a laxative. It consists of sodium phosphate, and we have also used enema on the night and also on the in the morning of the surgery. And this is oral antibiotic prophylaxis that we have used. And also IV antibiotic prophylaxis is also given in the form of injection metronidazole on the day before the surgery. And next, coming to the pre-anesthetic orders. This is the most important part in order to prevent any delay in the surgery or cancellation of the surgery. On the day before the surgery, anesthetist comes and sees the patient and he gives you a proper instructions based on the comorbidities that the patient have, or the drugs which the patient need to take if is already on any medication, or regarding any investigations that are to be needed further. For example, in a diabetic patient, we need the morning random blood glucose or fasting blood glucose, and urine ketones and sugars are needed. So that all that should be mentioned in the pre-operative orders, so that the nursing staff will know what to do before the surgery. And also in case of if the patient is a hypertensive, you need to clearly give instructions to the patient and the nursing staff regarding what medication to be taken. And coming to the emergency surgeries, here we can't expect a fasting rule. So we have to take a consent regarding the risk of aspiration and also any high risk consent that depends on the surgery that the patient is undergoing. And also make sure that the patient is adequately hydrated, so don't forget to chart IV fluids, and also the vital monitoring plays a key role here. This is the example of a preoperative orders of a perforation peritonitis case, when you need to take not just the informed and written consent regarding the procedure, and also any high risk associated, for example, risk of aspiration. And you need to catheterize the patient before the surgery and optimize the patient before the surgery and give him proper hydration. And next, coming to the daycare surgeries, you are seeing the patient in the OPD. So at that time, we have to write all the instructions that the patient needs to follow. And you have to clearly tell him when to come and at what time to come and where to come. So mention date, time and place of surgery, and give him instructions regarding the fasting and also regarding his medication use. And this is a preoperative checklist that we use in our hospital, which contains the patient details, the surgery the patient is undergoing, whether the consent has been taken or not, whether the preoperative orders have been written on the file or not, and whether the anesthetist has seen the patient or not, and what all orders he has given, and are we following them, and the part preparation, has it been done or not, and if we need any other extra special equipment for the surgery, have they been checked or not. And also there are some special instructions regarding whether the blood has been arranged or not. So make sure you have checked all these things and prepare the patient for the surgery. Always optimization comes before operation. So make sure you have prepared your patient well for a hassle-free surgery. Thank you.
Thank you very much. Do we have any questions from the floor? Anyone? Okay. So when you talked about the preoperative preparation, one part is very important, is the part preparation. You didn't talk about preoperative bathing. What is your opinion? Preoperative bathing or cleaning? Bathing or cleaning? Yeah.
Preoperative preparation, the parts which need to be prepared.
Can you talk in the mic, please?
In the preoperative part preparation, that depends on the surgery that the patient is undergoing. For example, in a breast surgery, we prepare the parts, breast and bilateral axilla. And for example, in a abdominal
No,
surgery,
you didn't get the question. So have you read the Lancet publication 2017? It's a WHO guidelines about decreasing the rate of infection. Have you gone through these guidelines? No. Okay, so I suggest all of you to please read those guidelines published in the Lancet November 2017 publication, WHO guideline, 9 strong recommendations. One thing is very important, the part preparation is use of the clip, hair clipping. If it is required, if you want to actually do the shaving, so that's not recommended. Better you do the clipping, one. Regarding the pre-operative bathing, the WHO recommends that it's recommended, it's necessary to do. Either by a chloroxidine wash or a simple soap will be equal. So that's a very important thing.
but that is actually, we don't write it in the preoperative orders, right? So that is done on the table, so that's why I didn't mention it. Yes, I suggested him to take bath on the day of surgery also.
And right is specifically to clip the hair, not to shave the hair. That's very
The
important.
clipping has, ideally it has to be done on the table, so
On the table.
that's why I didn't mention
on the
it in
table.
the
Agreed.
preoperative orders.
Thank you.
Shaving is not recommended, shaving.
Everyone, myself Dr. Ashwin TM, Junior Resident 2 from Jawaharlal Nehru Medical College, AMU Aligarh. My moderator is Dr. Muhammad Yusuf Afaq, Assistant Professor of Surgery, JNMCH Aligarh. Informed written consent. My topic is informed written consent. Coming to the introduction, consent